Our next presenter is Ms. Silvana Rossini, who will discuss complementary spirit therapy effectiveness for symptoms related to mental disorders. She is a holistic lifestyle coach, has a master's degree in integrative health and healing from the Graduate Institute in Connecticut, and through her knowledge and experience, she helps people find balance between mind, body, and spirit. She's also a volunteer worker at the Spiritist Society of Bridgeport in Connecticut, working as a fraternal assistant and children educator.
Good afternoon, everyone. I'm so happy to be here. I would like to thank Sonia, Dr. Sonia Doi, for inviting me to share with you my very simple and humble study that I did as my final project in my master's degree, where I graduated in 2014. And this study I called Measuring the Complementary Spiritist Therapy Effectiveness for Symptoms Related to Mental Disorders. To do my research, I use a database from a Spiritist Center. Just go here. So the reasons I decided to do my research in this field, I had two big reasons, but before I just get into these 2 points, I just want to mention when I was going through this course, in the middle of this course, I looked for help for myself, and I went to the Spiritist Center in Bridgeport to get help. And I went to the fraternal assistant, and it was very helpful for me. So this, in the middle of my course, I was looking for each field I would do my research, because this course, I was studying 22 different modalities of alternative medicine. And one of these studies was in spirituality. And then I, as a person who was receiving the help, I said, well, this could be a very interesting topic to try to find scientific proofs to show more people how this spiritual help can help much more people. And then I started going through some research and see if I could find something to give more scientific base to my study. And one was the growing number of mental disorder in the United States. In that time, in 2013, 25% of the American population were diagnosed with some kind of mental disorder. In the classification for mental disorder, according to the National Institute of Mental Health, was depression, bipolar disorder, suicidal thoughts, anxiety, stress. And this has really blown my mind. I said, 1/4 of the population, just in the United States, are suffering some kind of mental disorder. So this is a very strong point for me. And then I started to going through places to find scientific studies. And then I found that there's a lack of methodological studies, especially here in the United States, where there's disconnection of spirituality and traditional medicine or health. I found some studies done in Brazil in the efficiency of the passe, or the laying on of hands, the efficiency of the prayer to help patients recover from some kind of mental disorder, but I didn't find none here in the United States. So that's why I decided to do my research in this field. For who doesn't know what fraternal assistant, or we call spiritist therapy, I'm going to just give you a very quick idea in a nutshell how does it work. It's comprised of a fraternal assistance sessions, laying on of hands, passe in Portuguese, intercessory prayer, magnetizer or fluidified water, and spirit release therapy, dispossession. Not all centers, they offer services as a fraternal assistant in the same way, but the main point and the main idea is to help people, and most of them use these steps. And then I built my research question. Can the complementary spiritist therapy be effective for cases related to mental disorder? And here's the methodology I used. I just had one center, and that helped me with this, and I'm very, very grateful that they could help me with this data. And just to mention, all names were kept very confidentially. The only thing I could access was the numbers and the reasons for the treatment. Another thing I would like to mention, most of centers, they are not there to collect data. They are there to offer services, to help to people, especially in the fraternal assistance. But I'm so glad that this Spirit Center of Bridgeport, they offered this, and I could use this database to help with this research. So, and then with this database, we had 150 total cases that the fraternal assistants that were in this database. And then we filtered from these 150 to 128 cases that were closed, either as success cases or person just stopped to going to the treatment and then was canceled. But the total was 128 cases that were closed. From there, we filtered one more time and go to 24 cases related to mental disorder. That's exactly where we based our study. And then the ratio to decide if the treatment was success or not was 50%. If higher than 50% would be considered a success. And we found that, yes, 63% of the people that went there to look for help and go to the fraternal assistant or the spiritist therapy, they get either cured or improve their health. And there's another thing that I just want to mention in this. Besides the number that we found, we analyzed the factors that contribute to this success. And we found three was the most repeat in most of the cases. Was one, the longer the individual remained committed to the treatment, the better. Because change comes from within, over time and effort. The more they go, they study more, they learn more about themselves, and that's, the chances are higher by improving them health. The second one, the treatment worked with similar success rate independent if they have a previous religion. If they believe they can receive the help, if they are willing to go inside and treat themselves, this is the biggest thing that can help the individual get better. Because once we are open to receive help, we can go back to our balance. That's exactly what we always try, especially when we are going through any kind of mental disorder. It's sure we're not in balance. So that's why we're going to go back to our balance. So in the third one was the prayer. The more often they pray, the better they get. And this was a very simple study. I did just with, like I said, just one center. But I have some suggestion for this study, and that the similar methodology could be applied to a wider database, encompass several spiritual centers and spiritual hospital. I know in Brazil they had studies doing in some hospitals, but here we don't have any studies doing this in this field. And in terms of geography, we have more than 70 centers in the United States. Maybe we could, just try to expand and do something and try to find more information and spread this word to help more people. Even though when people go through this mental disorder, they are seeking for help in a regular basis, in regular doctors, they are receiving their help there. But if they combine the regular treatment with a spiritual approach, the chances of getting better is much, much, much higher. And another thing, when we as I would say, as a spiritist, we see this improvement. For whose I now, after I graduate, I start to work in the center, in the fraternal assistance. And I see with my colleagues every week, a lot of people come asking for help in such a despair. They have, usually when they go to the center, they don't have much hope anymore. They are really willing to do something to get better. And when they start to receive the help the spirituality can give, it's a transformation. Because they can combine. Yes, and we encourage them to keep going to their regular doctor to take the medicine, because the spiritist comes as a complement. Because it's invite us to go to the root cause. Because we start to go inside to know ourselves better. And that's the way to improve our health. And I think if we could inspire at least one or two to continue to do this kind of research, not only in the mental disorders field, but in a physical, even some alleged spiritual symptoms. Because 25% of a population, and today still one in 5 American are diagnosed with mental disorder. And we are talking just about United States, and we know this is a situation in the whole planet. So why not? Why not try to help more people? And one other thing that I think it's worth to mention is that every service in the center are offered free of charge. So everybody that works at the center are volunteers. And I would say the biggest payment we have, it's what we learn in being there and help ourselves grow as a spirit, as a immortal spirit. So that's what I would like to deliver, this very simple and humble research. I know I have all my paper here and with all this data and collection, and I'll be more than happy to send to anybody and to discuss more in detail about this. And I really appreciate the opportunity to share with you and be here. Thank you so much.